And again, I bring greetings from the OST tribe. And also, I also want to extend our, our just our own perspective as the OST tribe, and fulfill the wishes of our tribal council, who passed I believe two Medicaid expansion resolutions supporting, this. They did one last year, I believe. They also did one this year, just recently, at their last council meeting. And I too like to bring younger tribal leaders with me to learn. Councilman Carlo is here. I don't want to skip but one of the things that I also want to acknowledge Councilor Chairman Jeff Beagle, who's helping lead some of these efforts around Medicaid expansion and just the conversation within the council internally. And I think one of the biggest things, I don't want to go on too long, I'm going to turn it over to Councilwoman here, but one of the biggest things with Medicaid expansion is it's actually going to bring more jobs to the community. It's going to bring more resources to all South Dakotans. It's going to bring, I think people are worried about the cost and all that, but the federal government's going to cover 90% over the first 2 years, then 95% after that. But just the sales tax alone is going to make up for that. I think sales tax on this, on these costs, would be estimated at $60 million, I believe. So that's going to pay for itself. That's one of the biggest things that I know coming from the South Dakota State Legislature, that it's always how we're going to pay for it. That's always the comment. That's that's the answer right there, is that it's going to pay for itself. But it's also the second investment. As some of the chairs said earlier, the biggest thing is always investing in our own communities, and just thinking about like what our ancestors negotiated for in our treaties of 1868, 1851. The fundamental tenets of that was health, education, welfare. So remember that: health, education, welfare. And IHS, is right now the entity to do that for the reservations. We also have, urban health providers like Boyante Healthcare and other areas that could be innovative and could really help close the gap. And South Dakota is one of the few states. Actually, there's bills that are in people's names and they get turned over to collections. That includes healthcare bills, and you won't be able to get your license, you won't be able to get other entities if you don't pay those bills. And so I think that's one of the biggest things, is that we want to lift people up as they work and as they kind of come to these services, but also honor the promises of what our ancestors had those treaties for, especially in education and healthcare and welfare. And I think this helps cover that, close that a little bit. But it's just making sure that we as indigenous communities in South Dakota, Native communities, Native nations, you see this unity up here, it's a good thing. And this is something that we all care about for our communities. So with that, I'll stop there and turn it over to Councilman.